I'm going to get going. It's 8:35. Sinead Stagg here, chairperson of Mayo LGFA, and I'm absolutely delighted, first of all, to see the numbers that have come online on this Thursday evening. But I'm really delighted to introduce Dr. Lorna Joyce. And just to give you a small bit of intro from Lorna, Dr. Lorna is a mum of three and a Galway ladies football legend. Born in Clockbrack, some may say it's on the Mayo border. She played her school football in Coláiste, Weir Turmackeedy, reaching All-Ireland schools finals on 2 occasions with the Mayo side. Despite all this wonderful success in Mayo, we failed to lure her and to swap her allegiance to our lovely green and red. Her family are GA through and through, with her uncle Stephen Joyce and her auntie, the late great Geraldine Joyce. She has represented Galway at all levels, winning National Football League, Junior and Senior All-Ireland titles during her esteemed lengthy career, which is still going strong at club level in her new home of Killannon. The All-Star winning corner forward has represented Connacht on multiple occasions and has togged with a lot of our greats from 99 and 2000 and so on. Lorna is perfectly placed to deliver this educational session. She has experienced every facet of the game. Key to that is as a player and through her career as a GP. She has worked pitch side as a medic for both men and ladies teams, most notably with the Galway minor men's team, where her uncle Stephen Joyce was at the helm. I'm so delighted that Dr. Lorna was able to take time out of her own busy schedule, as we all have busy day lives and home lives when we get to it. So we're really honoured to have Dr. Lorna to speak to us, and I'm going to we have the chat function working there on the right hand side. I won't say this is not going to go uninterrupted with no errors or we're not professionals at this, but I want to thank Irene Cafferty from Kilmovee Shamrocks for proposing this actual topic for tonight, and really, as I said, delighted that Dr. Lorna has given her time. So look at, you've heard enough from me, so I'll let you over to Lorna, and we'll take it from there. But as I said, if you want to put some questions in the chat box, and we'll try and filter through them as much as we can. Over to you, Dr. Lorna.
Lovely. Can you hear me okay? You'll let me know anyway, Sinead. Is that okay? Can you hear me?
Yeah, we can. Yeah, can.
Perfect. Listen, what an introduction. Thanks. I was going to give a little intro on who I was, but I think you've given me a lot more credit there than I deserve. But listen, I'm delighted to have been asked to do it. And I will say I'm a bit rusty on these types of things as well. And I'm by no means an expert in this. But yeah, I think day to day, between playing and watching and obviously being a doctor, you kind of have a little bit of, extra knowledge anyway there. So, but yeah, not an expert. And like, just as the advert had said on Facebook, it's going to be 30 minutes, nothing, we're going to keep it short. And I'm hoping that everyone will be able to just take maybe even one nugget of information. It doesn't have to be anything major, but just a little bit of a summary as to what this is all about. So you can go to the next slide there, Sinead. So
1 sec there now.
All right. So yeah, I mean, this is just literally the few little areas that we're going to talk about. Essentially, I suppose, first of all, what concussion is, but then, what kind of symptoms we can expect to see, both on the pitch and maybe after as well. And then also, a pitch assessment, I suppose. Obviously, this is really targeted for all of us that are just on the sidelines, maybe watching games, involved, maybe a parent or ourselves, not to be, learning how to do any assessments, but just, I suppose, the types of things you might ask or what you're looking forward to, or you're looking out for when you're looking at the player in front of you, and then what you're going to do in that situation, really. And then just very briefly touch on return to sport, what's kind of involved in that, because again, it's not something that any of us will be, as mentors or as coaches will be getting involved in, but just to know what's involved, and what sort of is the average expectation on a player who has suffered a concussion. And then just where I got the information from, I suppose. There's time for a few questions and answers. Again, I probably won't have all the answers, but I'll do my best if there's anything, any burning things that people want to ask. So you can move on there. So concussion. So, I mean, what is it? Like, it's essentially a brain injury, which is why it's so important. And it does result in a disturbance of brain function. So I suppose for that reason, it needs to be taken seriously in order to protect the short and long-term welfare of all players, both male and female. But actually, interestingly, over the past decade in particular, there's been evidence to suggest that female players actually can be more susceptible to concussion. And I guess it's not, obviously it doesn't just happen on the pitch, it can happen in all facets. And I suppose I'd see it a lot day to day in, not a lot, but you would see people coming in with head injuries who suspect that maybe they might have a concussion. And I usually kind of say to them that it's like having a bruise on your brain. So sometimes that analogy helps people understand, because it can scare people, because obviously when we're talking about brain, anything to do with brain injuries, it can be a little bit scary for people. You can move on to the next one there. So when do we suspect it? So, I mean, we suspect it really when there's been an impact to the head. It can be to the body as well, and then indirectly affect the head. And it's basically when the player seems different than usual. So there'll be visible clues, there will be what they're telling you, and then how they're behaving as well. So, that's when we suspect it. So, a bad collision, and thankfully we don't see it that much, but none of us are immune to the sort of adrenaline rush when we see it happen. Whether you're a medic or not, or whether you've been trained in first aid or not, it's never nice to see when there's been a significant collision, particularly when someone is complaining about the fact that they've hurt themselves in the head as well. So next slide there. I just put this in just, I suppose, to remember that, like, the basic was a first aid are still really important. So obviously, someone might have hurt their head, but they might be, bleeding from their, knee or their arm or whatever. So it's just the basics still hold true. And just, I suppose, the simple things of asking what happened. Are you hurt, or, what happened to you? And also just to know your player. Obviously athletes with maybe physical or developmental disabilities have a lower threshold maybe for removing them from play when they've hurt themselves. Particularly when you think there may be a head injury involved. And as coaches and mentors and that, it's important for us to kind of know as well, if a player maybe has had a previous concussion, that mightn't always be offered up. But I guess if you do know it, it's going to, again, lower your threshold for removing a player like that from the pitch. Because as we know, a lot of the time there are no medical professionals available, and these things happen at trainings, and they happen in underage games, where there aren't people around. So it's just, I suppose, using your the practical side of your brain as well. So we can go to the next one there. So yeah, this is I suppose awareness of what we can ask someone. So I suppose I've alluded to the fact that it's when you get a bad head, and so yeah, I mean, I guess that in itself is enough of it. There doesn't have to be anything else. When you're the first person, they're wondering what's happened. Sometimes you're panicking as well. So I suppose it's that thing of just grounding yourself by being able to just ask a few questions, So, this thing of, I think in the past, certainly when I was playing all through the years, people would say, oh, how many fingers am I holding up? What's your name? Where are we today? And you'd be kind of laughing. But it's like, we know now that's probably not enough. But at the same time, we're not expected as non-medical people to know what to ask. But like, a couple of more questions can actually really help us, and it helps ground you as well. So even just asking, okay, where are we? What game is this? Who scored last? What team did you play last week? Did you win? So you're kind of talking about the present time, where we are, what's just happened, and maybe what's happened previously. So it's giving you that kind of now, so the immediate past, and more recent past, and then obviously a week ago. So even just having that in your head, just to ask those couple of questions, will help things and help you know whether there's maybe been something more significant. So we can go to the next slide there. So I'm going to try not to use too much medical language and things, but I suppose we do talk about signs and symptoms, but that's basically just, what they're complaining of. I'm going to show you the slides of each of these after this, but, what you're seeing and what they're saying. But I just put a few little sort of information nuggets up here, I suppose. Firstly, that I think people think that with concussion, I don't know if they do, but sometimes I get the impression that people think there must have been a loss of consciousness. But actually, people being knocked out is thankfully quite an uncommon feature of concussion, and actually only happens in about 10% of cases of concussion. So we don't see it much, thankfully, and it's not a common symptom. It is something that can happen, definitely, and it is actually more significant. So if somebody comes to me in the GP surgery and they've told me that they've hurt themselves in a match or otherwise, and they've said that there was a loss of consciousness, so that they were knocked out, that would be a more serious concern for me, and I'd have a lower threshold to send someone like that for further testing and imaging and things like that. But I guess just from that perspective, it's not something that happens too much. So for that reason, it is to recognize other signs and symptoms, which I'm going to show you just 3 brief slides on those, what the symptoms are, what the signs are, and what to look out for in the person. What's really important, and I think is a big take-home point for people to remember, is that some of the symptoms are indeed immediate, but some most definitely can be delayed. So, them being okay in the moment is not, is good, but obviously not enough to say that they haven't suffered a concussion. So it's very, very important to realise that this is the case. And that's why monitoring is a really important part of the management, or that initial assessment period, that you're just monitoring that player over time. And it's good for everyone to be aware, because sometimes as a coach or a trainer, you're in the thick of the action, and it might be someone else that's noticing something happening from the sidelines or from the stands, or as a parent, or other players even. So I mean, none of us, we all need to know a little bit about it when we're being involved in Gaelic games. So we can move on to the next slide there. So yeah, I've just put down, I suppose, the most common symptoms that the player might allude to. So although I said they're not immediate, they do tend to typically happen in the first 24 to 48 hours following a head injury. And generally, most of the symptoms will be there by the time the 3rd day has up to the 72-hour period. But like typically, I suppose they will be more immediate than that, up to 3 hours. And I'm giving lots of different information there, but essentially it may not be immediate and can be anything up to 3 days. That's what I would say. And here are some of the symptoms, like you can see from the slide. So headaches, I think that's probably something we're all maybe aware of. Yeah, headaches would be one of the most common things we see, and they can be mild, they can be more severe, but generally they tend to be more mild. And then dizziness, the one, people complaining of feeling dizzy. They can feel like they're in a fog, that they're just not clear. They can feel very fatigued for no reason, just really tired. Again, remember, it's a brain injury, so there's been an injury to the brain. The player just doesn't feel right, so they can't really say what it is, but they just don't feel themselves. And that's important, So that's why concussion is where there's a difference in how they normally are, and then possibly a sensitivity to light or to noise, so maybe not as common. So yeah, they're the most typical symptoms that we would see. You can go to the next slide there. So the physical signs. So yeah, that's what you're seeing. So what you're seeing in the person. So I mean, the obvious things would be the actual injury. So I mean, not everyone's going to actually see what happened, but if there's been a significant collision and they're clutching their head, you can see that down as one of the, and that's obviously something you're going to be worried. Obviously, in the immediate aftermath of that collision, what would make you more concerned. I mean, I'm sorry if I'm being a bit obvious about these things, but sometimes it isn't. Like, I learned a lot actually as well when I was preparing these slides, just to say. But yeah, lying motionless, falling unprotected to the playing surface, or slow to get up. You're just going to be more concerned if someone has had a collision involving the head and any of these things have happened. Loss of consciousness, I've already said, not a very common sign, but can be there, but thankfully not too much. Vomiting, again, when I looked at this as a symptom, I think, particularly in kids, when they get a head injury, they often can sort of vomit because they're sort of in a state of shock. What would be more concerning is repeated vomiting, or a few times, and you wouldn't expect that on head injury patients. You'd expect something a little bit more serious. They can just have a vacant facial expression, so they're looking at you and they're just kind of dazed. They don't, they can't really express themselves properly. I've mentioned the clutching the head, a bit staggery, so staggering, lack of balance. Sometimes we see that with I think most familiar would be when you're watching the rugby games and you see those bad collisions, and you see when they get up and they're that bit unsteady, and they're always brought out for a head injury assessment in that scenario. Even if they didn't have an injury to the head, that poor balance or lack of coordination is taken seriously. Or they may have slurred speech. So they're all things that may be signs of them having sustained a concussion injury. We can go to the next slide there now. Yeah, these are just some of the other things. Again, I suppose they're not really things that you'll notice on pitch side or that, but I suppose these are the things that the players can describe happening to them, in their day-to-day life when they have sustained a concussion. I suppose the loss of short-term memory, if somebody doesn't remember what's happened to them, then that is a very significant thing. So, they've clutched their head, they've felt something happen, or they've been in a bad collision, and they're saying they don't recall what happened, immediately that is a sign of concern. So we call it an amnesia, lack of memory. And in general, we take that serious as well when they come into us, having said that has happened. But then in the longer term, I suppose you hope that hasn't happened. But if the other things they can complain of would be a difficulty concentrating, a decreased attention, and then diminished performance. So that can be, not just with their, pitch performance, but diminished performance in life, in schoolwork or college work or normal work or day-to-day living, really, at anything that they just don't feel they're able to perform as good as normal. We can go to the next one there. So behavioral changes. So there can be any of these things too, believe it or not, when you've had a significant brain injury, or concussion injury, I should call it, not a significant brain injury, concussion injury. Irritable, angry, mood swings, you name it, nervous, anxious, sad, depressed, withdrawn. They can all be symptoms that are behavioral changes that can happen as a result of a concussion. Okay, can move to the next one. The last in terms of this is sleep disturbance. So they can be drowsy or have difficulty falling asleep, or just very fatigued, like I mentioned earlier. Okay, so what do? We can move to the next slide there. So I suppose, if you see a player where you think there's been possibly a concussion injury, or they've had a significant collision, and they've any of the above signs or symptoms or behavior changes have occurred, you need to permanently remove them from the game or the training session. So you recognize it and you remove them. That's really the key point here. I suppose how they're dealt with, managed, how they're assessed, all of that is really done by a healthcare professional. And I just put in the other bit about the cervical spine injury. I suppose there are red flags, and I'm going to briefly go through those in a minute. But if someone has said that they felt a severe pain in their neck, that would be the one situation where you do not move them. So if they've, they're complaining of severe pain in their neck, do not move them and call an ambulance, because you'll do more harm in that scenario. But otherwise, any of the other signs, symptoms, behavior changes, anything, we would recognize it and remove them. And just remember that symptoms are not always immediate. So, it's actually, if someone has a significant collision involving their head and they seem perfect and they're saying they feel fine, it's still, I would say, best practice to take them off and, watch them and monitor them, because you just don't know. Any of the above symptoms can be delayed. And so enough for you to, you're not going to be wrong in removing them from the field of play if you think the collision was bad enough to warrant that in the absence of symptoms. So I think that's another really important take-home point. And the next slide there, Sinead. So yeah, that's just really reiterating the point. If in doubt, sit them out. So that, I think, is very important. And as I say, the impact itself is enough of an indicator always have to be because of the symptoms. Okay, next slide. Yeah, that's it. Red flags. Yeah. So look, I mean, you can't know everything. I think like if you can sort of keep the basics in your head, but I guess these things on the right are some of the things in which us as physicians would say are red flags, meaning they are much more significant and can signify a more severe brain injury or spinal cord injury. And they can occur in a similar way to concussion. But if any of these symptoms on the right were present, they would need to be brought to hospital immediately. So like the severe neck pain, you call an ambulance, you don't move them. A seizure, it's probably obvious enough, but just to mention that one. Loss of vision or double vision. So it's funny, symptoms are often, people coming into the GP, they often say their vision isn't right, but actually when you go down into the nitty gritty of it, it's generally not that they've lost vision or that they have double vision. It's maybe that their vision is cloudy or blurred or zigzag lines, and they're actually not concerning. A loss of vision where your vision actually is gone on you, or you're seeing two things rather than one, they are actually quite significant symptoms and can mean that there's a more significant brain injury. So you'll be calling an ambulance. Prolonged loss of consciousness, I suppose that's pretty obvious. Increase in confusion. So where they're a little bit, dazed, etc. Okay, maybe a concussion, or most definitely a concussion. But if that confusion is getting worse and worse, that is not something you sit on. That is more alarming. As is weakness. Weakness in itself, they can feel a bit weak, but I suppose a significant weakness where they can't feel their leg or they can't feel their foot, or they've got tingling and burning all over in their arms and legs, again, hospital transfer. Repeated vomiting, I said that before, that's unusual, to kind of consistently vomiting, or to have a severe or increasing headache. So they can say my head is sore, or like I'm sore at the point of, they're sore at the point of impact, they're feeling sore, but it shouldn't be getting worse and worse, becoming, a very severe 10 out of 10 headache where you can see it's getting much, then it's more serious. Agitated, restless, it's a bit vague, but yeah, abnormalities of gait, they can't find their feet, they can't walk, they've no balance at all. That would be concerning. Slurred or incoherent speech. So again, that would need to be pretty significant for worsening speech issues. You may want to get some extra help in that scenario. Okay, so next slide there. So I suppose these are the important things as parents, maybe a player that's with a player who's had a concussion, or the mentors. You don't leave them alone for at least the first 3 hours. So somebody needs to bring them home. They shouldn't be sent home by themselves. So whoever that person may be, but somebody needs to bring them. So they shouldn't be driving if they are older and they've come in their car. Be driving home. So that would be important. And again, because as I said, the symptoms can actually develop in the few hours after the head injury. They obviously don't return to play on the day of injury, so that's an obvious one. But yeah, obviously they don't return to the playing field. And worsening of symptoms would lead you to get immediate medical attention. So it needs to be a responsible adult, and that's important. And it goes without saying they shouldn't drink alcohol or use any drugs, or you shouldn't be saying, oh, take an Nurofen, or giving them something on the sidelines. Don't be giving them anything. So things like that can actually increase or a brain bleed. So yeah, basically don't be, just make sure they're with them.
How are you? That's good.
Okay, the do's, kind of repeating myself again, so we're nearly there, to be honest. So stop playing immediately. So get them off the field, seek medical assistance, and after that, the usual protocol is that they rest for 48 hours. I'm going to show you a little bit on that now in a second. And yeah, as a parent, so to minimize everybody should be doing this, but I suppose it's important for parents to know to minimize the use of screen times directly after as well. So next slide there. Yeah, so I suppose, like, I'm not going to dwell on this because obviously nobody here is going to be doing a concussion assessment, and actually it shouldn't be just anyone either. Somebody needs to be someone who's familiar with a concussion assessment, if that's something that is going to happen, say on the pitch side or whatever. That isn't done by anybody, but like, I guess a lot of what I've touched on is actually part of this concussion recognition tool 6, CRT6, which is actually available on the LGFA website, and it's actually basically what I've done is a summary of that now. So basically the things you can ask and should ask and to look out for. So that's just, I mean, if anyone wants to look at that, it's basically a 2-page document, a summary of what we've kind of discussed. But yeah, the concussion assessments are done by healthcare professionals who are familiar with how to do them. Return to play. So the next slide there, if you don't mind. Again, it's not something you're going to be in charge of, but I suppose it's good to know what type of recovery or return to play protocol would be, the general one that we would look at. So usually, as I said, they're resting for the first day or two. We call it relative rest, so not like strict rest. So rest, they're still doing their daily activities. And actually that, like a little bit of light walking and things like that, can actually improve the outcome. So we call it relative rest. So, but anyway, they're not playing football anyways. And then there's a gradual return to play program, and it's kind of, I suppose if we were to sort of summarize it, every 2 days you could sort of graduate onto the various different stages. So you might start with a bit of light activity, and then you might do some sports specific activity, and then eventually non-contact training, and then back to contact training. But at any point, if the symptoms return, you would return to the previous stage, the stage at which the symptoms were not so significant, before you would continue on. And yeah, I mean, on average, it takes about 15 days for that whole process to occur. But interestingly, players under the age of 18, should be at least 21 days from when they're first diagnosed. So that's an important point to make as well. Next slide. Yeah, I think it's important that, if you're a mentor or a coach, or when you're involved with the team and a player suffered a concussion, that you just make all the other mentors and coaches aware that this has happened. This is particularly important because a second catastrophic injury or a second head injury can lead to the second impact syndrome, which can be catastrophic. So there's a high, poor outcomes in these scenarios where somebody gets a second head injury directly after a first, and it can actually be fatal. So, look, I suppose we're not going to dwell on this too much. It's not something that happens much, but I guess it's just the simplest thing you can do is make sure that everyone around you who are involved in that team know that it's happened, and that, look, Mikey got a bad knock, or Michelle got a last day, and we had to take her off, and I've told her to go to her doctor or whatever, and everyone's just aware. And then, you mightn't be at the next session, and they can say, "Oh, did you get sorted? Or how are you feeling?" So yeah, look, that's just an important point to make. Next slide there, Sinead. So yeah, again, I mean, it's not just about returning to play, it's about returning to school, to work, college, whatever the case may be. So again, when we're advising people what to do, I suppose it's that their daily activities aren't going to provoke their symptoms. So again, that's where screen time and different things comes into it, because that in particular can exacerbate symptoms. They might start with school activities outside of the classroom. Some kids are quite fatigued and have a very headachy, and they just don't feel right. So they mightn't return to school straight away, but might return to school part-time and then full-time. And they might be glad of that. The parents might not be. I definitely would be. Find it tricky, but yeah, that's important. Okay, and the next one there. We're at the last 2 slides now anyway. So yeah, recovery. So most players will recover within a month. So, there's a small cohort, 10 to 15%, that will take longer. But what we do know is that if we manage it correctly, it decreases the risk of a long recovery. So, the better we manage it in the beginning, the quicker they're going to recover, and the quicker they're going to get back onto the field to play. So I suppose it's just important. So yeah, next slide. So in summary, yeah, I guess concussion injury, where there's a change to that player. And it's just to remember that the symptoms they may not be immediate. The collision itself can be enough of an indicator in the absence of symptoms. So again, as I say, if it's a very significant collision and you feel they've got a bad bang to the head, it is totally justified to remove that player from the playing field and let them sit it out and see how they are over the next while. So it's important to recognise, remove, use the people around you, see who saw it, who saw the injury, who saw the collision, all of that. And if in doubt, sit them out. Next page there. Yeah, so basically, a lot of actually most of what I got was readily available on the GAA websites, both the LGFA and the GAA. The guidelines are slightly different for males and females, but what I've essentially done here is summarized them really. But there are good resources available actually. So the first one there is the concussion management guideline for Gaelic games. It's really good. I suppose not all of it is relevant for non-medics, but certainly there are parts of it that are. On the Tubber, then anyone who's coaching and that will know about the Tubber website as part of the LGFA. There's an e-learning module on that as well. I also found a really good poster. I don't know, people here might already be aware of it. I hadn't seen it before. A one-page poster, which I thought would be a really good one to have up in dressing rooms and things. And it's literally just summarised again the symptoms, what to do, the red flags, and it's kind of colourful, easy on the eye poster. Really nice one to have a look at. And yeah, I mentioned the e-learning on the Tubber as well. So yeah, last slide is just basically to say thanks a million. I hope I didn't talk too medically, or I don't know. Hopefully everybody can have learned even one thing. But yeah, so if anyone has any burning questions, hopefully there won't be too many, but happy to answer anything that might be relevant.
Yeah, can you hear me there?
I can hear
you. Thank you for an informative session. And could we get the slides or resource info, please? Yeah. So what we're going to do is we've actually recorded this session. And so instead of us having to recreate the wheel, that we'll be able to share it with them and hopefully put it up on our website as well. That would be readily available for everyone to be able to access again. I think just one of the key things that I found there was the awareness and the kind of calming yourself as the coach on the sideline. Because sometimes that's the most pressurized, where you're on the sideline and you're looking at a child and you need to try and help, and the match is still going on, and it's to try and slow things down for everyone and just deal with who you have in front of you, and to ask the simple questions that helps you, but it's as well, test the child as well, or the player. I would have said that for me would have been one of the key things to take out of it. And that poster, we'll get that poster shared out as well for all the clubs.
Yeah, no, immune to the panic when even for me, when someone, because it's always out of context, you're there either watching or coaching or playing, so you're having to deal with those situations kind of quickly. Yeah.
Has anybody anything that they'd like to ask? You can put your hand up and you can have the floor if you want. I know Samantha has said there that thanks, have been through it recently with 15-year-old daughter, and everything here was very relevant. And it is, and I suppose even in Mayo at the minute, we had 2 or 3 girls on the senior squad like that, got heavy hits, and have been out through concussion. So it's fairly out there right at the minute, I suppose, particularly with the girls and the heavy hits that they're taking and the frontal tackle, which I don't like in the first place. But
yeah, in Galway there's a GP, Enda Devitt, who kind of specialises in concussion injuries, and he will actually see people from all over. If you as a parent or a player yourself wanted to have sort of a consultation and you weren't sure about the return to play, or he'll examine, do the assessments, and provide guidance as well. I'm not sure if there's anybody in Mayo.
Yeah, John Correll in the UPMC in Bacon does that. And but actually, one thing that I did notice, there was a girl actually for one of the Mayo teams was she had got concussed in the first half of the game and she was going home, and her mom was saying to me that we're just going to go home and she's going to go to bed. And I had spoken to a previous player, Noreen Moran from Westport there that played for Mayo Ladies. She's had plenty of concussions, unfortunately, but she had like a template that she was given, and she was like, that she's not to rest. As you said there, it's like an active rest, that it's not to be lying down or taking the Nurofen or taking the paracetamol. It's you still have to watch them for the 3 hours.
Exactly. It's sort of yourself to light activities in the first 2 days, not to just completely lie on the couch, and actually the outcomes are better if you do that.
Yeah. Elaine Tracy asked there, great session. Thanks, Lorna Sinead. Is going to the doctor the safest way of knowing player is clear? Connacht Rugby have a very strict protocol before back to pitch.
Yeah, there's obviously protocols before returning to pitch if you've been diagnosed with a concussion. Obviously, like if you're playing with Connacht, there's going to be, very set protocols, and actually their exam different. As I know, is it 3 days and again 3 weeks? They're going to be examined at different stages. But I guess, if you're a player and or you're a parent, yeah, unless there's a red flag or something serious, they've lost consciousness or something like that, you just go to your GP for that initial consultation. Because oftentimes it's and often I suppose not everybody is going to be an expert in concussion, but at least they'll be able to tell you whether you need to go to hospital or not, and just go through what I said about taking the history and what they're suffering with, etc. But will really be I suppose doctor.
I know, yeah.
Sorry, there's somebody talking there.
I was expecting my kids to bark. They were given strict warnings to stay away from the office, but it's all quiet here. It's not too bad.
Yeah, horses really.
No, good. So yeah, Samantha said there they went to A&E in Castlebar. They were super. Yeah. I suppose as Dr. Lorna said there, it's very important just to look at the red flags. That I suppose that the hospitals are overwhelmed as well with and you don't want to be sitting in a waiting room either for hours upon hours. If you just have a look at those warning signs and see what's normal and what's not normal for the particular player.
Yeah. So a concussion doesn't have to go to A&E. Concussion is a brain injury, but most concussions don't require imaging. So I suppose it's more that period of rest and getting back to light activity. And a lot of them are going to say they have a bit of fogginess, they have aches, but it's safe to just rest and gradually return to play. So I suppose for most doctors in the absence of very specific guidelines in an amateur sport or amateur activities, we're going to be given that type of guidance, and also including the need to go to hospital. So if they've lost consciousness or they have any red flag symptoms, then obviously they're going to be we're going to refer them in for potentially observation and maybe imaging as well. But otherwise, most people don't have to go to hospital. So the red flags are where we're thinking there's something more significant than a concussion, where you think there's been a spinal injury or those red flag symptoms. That's what those are about. So hopefully they're not present, but they would be where you're suspecting a spinal cord injury or maybe a bleed in the brain. Whereas a concussion, no, it's more like, as I said, a bruise in the brain, and they've got these signs and symptoms from that. But in most cases, they wouldn't need hospital assessment really. But it's never any harm if you're not sure, because they'll observe them at a minimum over a few hours, and things can, as I say, get you can be fine and then deteriorate. So yeah.
Kevin is asking there, is there a GA specific return to play protocol time frame in the case of some minor symptoms?
Yeah, so it's actually on those references. If you go into them, I just summarized it there in a kind of a so I suppose the time frame is 15 days on but 21 days for if you're under the age of 18. But essentially, it's every 2 to 3 days you go through each stage. If I was just going to summarize it in a basic way. So, like in the beginning, it's your relative rest where you're just doing your light activities like walking. You feel fine after 2 days. You can graduate that then to some increase, maybe a little jog. You feel fine over another 2 days. You might go out doing a bit of soloing or hop, and you keep graduating every 2 to 3 days. If you get symptoms, you go back to the stage at which you were okay, and you prolong that for another 2 to 3 days. But that is actually available on the LGFA website. But I mean, it's kind of common sense, really, in a way, isn't it? So I suppose there isn't any specific. I mean, it's always best to go to a GP first, and particularly, I mean, players who are playing at a higher level and where there's team doctors and physios as well. Physios are doing them all the time. They're going to give them more specific advice. But I suppose for oftentimes this type of stuff is more for parents of kids or players that are maybe playing at club level and that maybe don't have those supports, that they're able to maybe reference something to know
Yeah.
what they're going to.
And Samantha was just in there for her own 15-year-old girl. It was all monitoring for the 48 hours and all the info that you gave there in the previous slides that it's here. So like what we will do is we will share we'll share and keep the recording of tonight. And as I said, the links are all there available, and we'll put them all as clickable links as well on an email that we'll share out to all the clubs. But just a genuine thank you from me on behalf of the Mayo LGFA executive to the clubs for coming on board. Great to see such a huge turnout. It is a big topic, and it's all learning, and we'll all help each other. But a huge thank you to you, Dr. Lorna. As I said, it's Thursday evening, you've had your day's work, and you're coming on board to share your expertise with us. So we really, really appreciate it. And we won't say all the best to Galway for the rest of the year and the end of this one.
I'm half Mayo.
Yeah, we'll get you back coaching in Mayo yet. Thanks a million, everyone. Really delighted to see such a crowd. And, if anybody from the clubs as well have something else that you'd like for us to be able to have an informative conversation about, let us know, and we'll do our very best to bring it to you. But thanks, Irene Cafferty, for bringing this one to the top of the table. Thanks a million. Thanks, Lorna.
Lovely. Thanks.
Thanks.